Well, the scholarship program occurred, 25 years ago, something like that. Loy and I had been talking about ways to get people interested in tenor. We had been attending work fairs and things like that for people who were looking for a future in medicine. And they were anything from students to interns to residents to fellows. But we would have to go. The closest place that we ever had to go was just Atlanta. But we also went to Nashville, and we even went to Memphis, and we went to New Orleans. We went places, all those places, trying to find enough people to staff our hospital, or what our hospital was going to be one day. And we spent a lot of money doing that, and we just were not very successful at it. So we decided that we would try to have something here that would attract the people here. And instead of trying to reach people that were from all over the country, why didn't we just concentrate on the people from the West Georgia, East Alabama area? So we went to work on putting together a master list of how many people were available right here in our home area, and it was astonishing the number of people that were training. They were postgraduate training, or they were students, and that type of thing. So the first year that we did it, we had like 25 people here. And if you went to a work fair for people in medicine, you were lucky if you got to talk to 25 people, particularly in detail. That was the beginning of this program. It started right across the hall in some classrooms over there, and it was well attended. It was well attended, but we got the word all out to the medical staff, and the medical staff attended and made sure to talk to all of the attendees and that sort of thing. So as it worked out, our first two people that we successfully recruited by doing that were outstanding young men, both of them. They were both training in internal medicine at the University of Alabama School of Medicine, and they're both in the top 2 percentile of students in the country. So we thought we had pulled off a pretty good coup by not only getting a couple of really good people, but we got 2 very top people. And we were competing for people to come here. We were competing with Hopkins and Vanderbilt and several other places, but in those 2 cases, we won, and we were very, very happy about that.
If I'm not mistaken, Jack, the money for the scholarships in the early years came from fines, I think, from the medical staff.
Correct.
If you didn't do your charts on time and so forth, there'd be a fine.
You got
and there were 2 or 3 particular doctors that contributed heavily to the scholarships in the early years.
Yeah,
that's what it was funded by, was people not doing their charts on time and so forth.
I can tell you from past experience, past personal experience, that the majority of, quote, hospital administrators, they weren't CEOs in those days, they were hospital administrators, would not have bought that idea at all. Loy Howard jumped all over it. He was not only was he in agreement with it, but was very enthusiastic, and he gave us all of the support that we could ever have wanted. I mean, we had the money, but when I say we, it was medical staff fines, but the money actually belonged to the hospital, and you come right down to it. But he took it to the board, and the board said, okay, and that's how we spent the money. But I'm convinced, again, I want to make this very clear, that if it had been anyone other than Loy Howard, we might have missed our chance.
The young doctors and the professionals that were here for lunch today, they're at an age where they got a lot of decisions to make about where they're going to do their residency training, and even more importantly, and long term after that, where do I want to live? And I've often made the statement that young professionals in the medical field, at least, can be busy about anywhere they want to go. That's not really a big concern when you're trying to decide where I want to practice medicine. Because you're going to be busy. So the important thing is to find a comfortable place that's a good place to practice medicine and to raise a family. And that's what I expounded on with these young people in there a little while ago. Touch briefly, Jack and I both have been here 50 years this year. So in 1968, when I moved here, had 3 children, would have 4, but we had 3 at the time, and mothers at that time would have to take a child to maybe 3 different schools. The 1st and 2nd grade would be on one side of town, and the 6th and 7th grade, that type of thing. So you can imagine the hassle that it would be early in the morning getting kids to several schools. Well, I don't know how long ago it's been, 30 or 40 years ago, the Board of Education, of which our own Dr. Tom Reeve, the late Dr. Tom Reeve, was the chairman of the Board of Education at that time. They made a very wise decision to buy, I don't know how many acres, it's probably 80 to 100 acres over close to this hospital, that now incorporates all the school levels, 1st grade through 12th grade.
Kindergarten too.
Kindergarten too,
Yep.
Absolutely. And that is really, really helped. But not only that, our educational system, both in the public arena and the private school of Oak Mountain, are very excellent schools. We grade out in the top several percent of each year of education in this state. Another thing that I found to be, in the development of things that's important to me at least, is that the city of Carrollton in Carroll County, surrounding area, by the way, there were 40,000 people in Carroll County when I moved here. When we moved here 50 years ago, I think there's 120 now, 1,000.
Mm-hmm.
But the point I'm making is that there are so many vocational opportunities for young people graduating from college now that a lot of your kids will come back here to work because there's opportunities to work in a lot of arenas. And the university being here is a major plus for this city. The university, the hospital, Southwire, all these big employers are there, and they have a lot of high-paid, very well-educated people working at these places. Mm-hmm. And the point of all that being that it's a pleasure to have your own children and grandchildren have the opportunity to come back and live in their hometown. And so that's a real plus. The other things that have happened in this city, all the way from, I mentioned the recreational opportunities for young kids to do anything, gymnastics, cheerleading, football, baseball, it doesn't make it swimming, all that is available at a very well organized, good facilities. Our churches, I know many, many pastors here in many denominations, and I can't speak highly enough. All those things are important in making a decision about where you want to live and where you want to raise a family and where you want to practice medicine.
Well, the proof of the pudding is that on our own medical staff, we've got at least 20 people who are natives of this community, went off, trained, and trained at some of the finest places in the country, and came back to Carrollton to practice. And they could have gone anywhere.
Yes.
It's amazing that they could have, where they could have gone, where they had offers from, but they chose to come home. I finished work one day and I got home about maybe an hour before dark, and my telephone was not ringing when I went in the door, which was very unusual, because usually when you left here, when you went home to talk on the telephone for 2 or 3 hours, but it was quiet. Very quiet. It was eerily quiet, and I remarked to my wife that something is wrong. This is unnatural for the telephone not to be ringing. I didn't get the words out of my mouth before the emergency room called and said there had been an explosion in Waco, a little community up within a few miles of here. A dynamite truck had blown up, and they didn't know how many casualties there were, but they were coming by the ambulance load to Tanner ER. We had 2 little emergency rooms, and that's all. And all doctors were called in. This is because this was such an emergency. All doctors were called in. It didn't matter whether you're an obstetrician, it didn't matter whether you're doing internal medicine, it didn't matter whether you were a surgeon or an ear doctor, it didn't matter. Everybody was needed. And I'll have to say, everybody was front and center in no time. And I thought we worked through that catastrophe pretty well. Tanner handled it, you know. Tanner Hospital and Tanner medical staff, we handled that thing.
As far as unexpected things, though, one that sticks out in my mind was no more than about 20 years ago when it was becoming the thing in hospitals nationwide of security, meaning that sometimes people would arrive in nurseries and steal babies, so, you know, just take them out of the nursery. So the hospital, Tanner was going to put on a big thing to in the event, simulate that happening. I didn't know anything about the simulation. And so that particular day, they had arranged for a mother, this was all set up, to take the baby out of the upstairs nursery, take him down the hall, and exit the hospital. And they were training for that. Well, I didn't know anything about that exercise, and I was coming into the hospital, up the steps, and I saw this mother with a baby in her blanket. And I started doing everything in the world to assist her and ask her if I could open the door and so forth. And the nurses were just about to pull their hair out because I had upset the whole apple cart in their planning procedure for that day. But a lot of good memories of a lot of stress, quite frankly. You're having to make decisions that involved two people, the mother and the baby, and those decisions had to be made within a few seconds a lot of times, and if they weren't correct, well, bad results happened. And so that was very stressful. But as time went on, I mentioned that the operating room was I think late 70s. We built the present location of the obstetric ward and then later a C-section room was put into that suite and made it so much safer and so much better for not only the doctors but especially the babies and the mothers. We could get things done in an emergency in 10 or 15 minutes instead of 45 minutes or an hour sometimes, and that was oftentimes the difference in the survival of a baby or not. So those were all very stressful times, but also very rewarding times. You know, if things turned out the way we hoped they would, and they did most of the time, it was very rewarding to see the outcomes of these situations. But a lot of experiences, a lot of great experiences, a lot not so great experiences in the Tanner system. But it's just remarkable the progress we've made, and I mentioned this in there a while ago about the NICU unit that just opened up this year, and how stressful it used to be having to send babies.
You better explain what that is.
Neonatal Intensive Care Unit, NICU. And that's for premature babies primarily, sick babies and mostly premature babies that are born before whatever 32 or 3 weeks. And through the years, it would just be devastating. We'd have a baby born at 28 or 9 weeks fighting for their life, and we'd have to call Columbus, mostly Columbus, later on Atlanta, to get that baby sent to the NICU unit by helicopter usually, to those units. And that was stressful enough and dangerous enough, actually, having to put the little babies through that. But to think of the mothers and the family situations where these families would sometimes have to go to Columbus almost every day, if not every day, for periods of up to 2 or 3 months or longer. Mm-hmm. So what a blessing it is now to have just this year the NICU, Neonatal Intensive Care Unit, opened up in the upstairs and with some wonderful doctors. Neonatal intensive care specialists that are pediatricians that have extra training. Mm-hmm. And so wonderful things are going to happen up there as far as taking care of little sick premature babies.
Remarkable things that have happened in the history of obstetrics in this community is here you have a World War II combat surgeon and the people at Harvard begging him to come there with them and train in orthopedics. And he says, no, I am going back to Carrollton, my hometown, and deliver babies. Now this man, he was a founding fellow of the American College of OBGYN, if you know what that means. Prior to that time, there was no certifying body for OBGYN. So Dr. Steve Worthy, with some other colleagues around the country, they founded that college, and that is the certifying body for obstetricians and gynecologists today. Isn't that right,
That's
Joe?
correct. And Dr. Worthy was a wonderful, wonderful person and doctor. The first, may have been the first specialist in Carrollton. I'm not sure about that, but he was one of the first, and definitely the first obstetrician after the war.
Can I take a moment just to tell you how Tanner's attack on heart disease? 1968, late 1968, we started talking about it, and once we started talking about it, we started moving on it rapidly. But we had to have some real advice about in which direction to move, although we wanted to get going. Now, I'll tell you why. Now, think about this. The death rate in this hospital from myocardial infarction, which is heart attack, was 38%. That means that 38 people out of every 100 with a heart attack would die. Shocking these days, really shocking.
I came here a month before Jack did, 50 years ago. And I was the 13th doctor on staff, and I guess he and Claudette Hayes came shortly thereafter, and were the 14th and 15th doctor. My understanding is there's almost 400 on the staff now. Of those 13 or 14 in front of Jack and I, only 2 besides us are still around. We've lost some very dear and competent friends during those times, 2 of which were this year. But the staff evolved and grew, and Dr. Alligood, who just recently passed away, was the first pathologist here. I don't know what year he came, in the early 70s, I think. And it just evolved. Dr. Fleck came as the first orthopedist, and I don't know how many they have now, 7 or 8 or 10 probably over there now, and he's still practicing. But so it just evolved into different specialties. Now, I guess, except for heart surgery and neurosurgery, I think maybe those are about the only 2 big things I can think of that aren't done here. And I don't know where it'll be in my lifetime or not, but heart surgery is going to be done here eventually. Well, we've been here a long time, and we've seen a lot of doctors. When medical staff, I'm going to focus on doctors, and just wonderful friends. I don't know where it's appropriate to say this or not, but anytime I meet a doctor, I know what they've gone through. They went through the same thing I went through, and so there, at the very beginning, there's a connection there that's just hard to replicate. And of course, all doctors that I've known through my life are not good people, are good doctors, but the great majority are people who've gone into the profession not to make money, but to take care of people. And just the great majority of doctors have been good friends, and who I didn't hesitate to call and ask, consult and so forth and so on. And since I've retired, or since before I retired, my doctors are all local and are good friends.
My best friends in all the world have been physicians, and my closest family relations have been with other doctors' families and so forth. There's something, I don't know how to put it into words exactly what Joe says. He says he doesn't, when he meets a new physician, he doesn't know them, but he knows what they've been through to get where they are. And that's just kind of an invisible bond of some kind. And I mean, when we were here with just doctors number 13, 14, 15, and 16, and that type of thing, there really was a lot of collegiality. There was a lot of orneriness too, especially with one person I can remember. But that is an analytical statement. It's not a critical statement. It's purely analytical. The other people that I've known on this staff, I've learned so much from them. I was not just friends with them. I did not just work with them. I learned from them. I learned things that are important to me to this day, and I guess will be with me as long as I'm here. Well, the funny thing is, you know, I've had all of these experiences, just like Dr. Parrish, like being in the grocery store or going to a restaurant with my family, with my wife, and sometimes with my children and grandchildren and one great-grandchild. People come up and speak to you, and they pat you on the back and say, "You were so good to Mama," or "My dad just loved you," or something like that. And I think about other things like that. I mean, that's one of those things money can't buy, Joe.
Correct.
And I used to think I would get called over here in the middle of the night because somebody was in just florid heart failure. You know, couldn't breathe, lungs full of fluid, and with just a panic-stricken look on their faces because they couldn't breathe. And maybe it would be an old person. Almost always was an old person, if you can imagine me calling anybody old these days. But anyway, you take them downstairs, and with relatively little treatment, I mean some oxygen, some diuresis, and that type of thing, and work with them a couple of hours, and now the panic's gone from their faces, and they're drifting off to sleep, and the family's not scared anymore, and the patient's now comfortable. And you say, well, I think it's safe for me to drift on home now. And this would be like 5 o'clock in the morning. And if you started to walk out of the room, the patient, an old person, would rise up and say, "Thank you, doctor. You can't buy that. You cannot buy that." And I may have grumbled and griped all the way to the hospital, but I felt light as air going home from the hospital. Strange way to make a living, but it's great. It's the greatest way to make a living.
I tell young doctors, students, that a lot has been done to diminish the capacities of physicians, their financial things and so forth through the years with the insurance companies. But then I say it's still the greatest profession that I can think of to go into, and you'll never regret it.
And if you love your work, you'll never get over loving your work. I miss it today. I've been retired 12 years, and sometimes I wake up at 4:30 or 5, which is the time I used to get up to come over here, ready to make rounds, you know, ready. And I'm thinking, I got to make rounds. Everything is ready. Got to get up and go, and I wake up and no place to go.